File item number 1, SB 107 by Senator Wiener. Please feel free to begin when you are ready.
Thank you very much, Madam Chair. SB 107 might look a little familiar because we have been pushing on this for 3 years now to try to make it easier for people to sign up for CalFresh in California. California makes it way too hard, which is why we are one of the lowest states in terms of CalFresh uptake, the percentage of eligible people who actually receive the benefit, and we are dead last when it comes to seniors who are eligible for CalFresh who actually sign up. It's actually, the state should be embarrassed by how poorly we do in signing people up for CalFresh, and we have to do better. And this bill will address 2 of the significant barriers to CalFresh applications. One is to finally mandate that every single county in California, all 58, allow people to sign up for CalFresh by telephone. And again, it's embarrassing that we need a bill to tell the state of California, to tell the counties that they need to let people sign up by phone. It's very embarrassing that we need a bill to do this, but a significant majority of the counties do not allow people to sign up by phone. And we're mandating that they do so. And so it's a pretty simple, straightforward thing. Again, it shouldn't take a bill, but alas, here we are with the bill. The other piece of this bill has to do with the application. And if you've ever seen the CalFresh application, it is 18 pages long, but that actually underestimates it. It's a very dense 18 pages long. I actually went through it last night on my iPad after I did my taxes on Sunday. And doing my taxes on Sunday was much easier than if I were to fill out those 18 pages. And we expect frail seniors and people with disabilities to fill out that application. And is it any wonder that we rank last, 50 out of 50 states, in terms of seniors who actually sign up for CalFresh? So the bill will mandate a much shorter, simplified form for anyone 60 and older or living with a disability. When you look at seniors and people living with disabilities, they are much more likely to already be on some sort of government benefit, whether it be Social Security or SSI or what have you. And so we just don't need to get as much information from them. To be clear, these are not the only things we need to do, but these are 2 significant barriers that we can remove with this legislation. And so I respectfully ask for your aye vote on SB 107. With me today to testify by phone are Jared Call, Senior Advocate for Nourish California, one of our sponsors, and Lourdes Gonzalez, who is a CalFresh outreach specialist with Feeding San Diego, which is a food bank in San Diego County. Thank you.
Mr. Call, please feel free to begin when you're ready.
Oh, sure. Good afternoon. Thank you, Chair Hurtado, members of the committee. This is Jared Call with Nourish California. I want to start by thanking Senator Wiener for his leadership on SB 107. This is a bill that will reduce hunger and poverty by cutting red tape to simplify access to CalFresh. As we've seen, the COVID crisis has increased the already high levels of hunger and hardship across the state. The most recent data show that nearly 1 in 4 California households are experiencing food insecurity. That's 2.5 times higher than before the crisis began. And the numbers are even more stark among Black and Latinx households, which respectively face levels of food insufficiency 3 and 2.5 times higher than their white counterparts. CalFresh is our most effective anti-hunger program. Yet nearly 30% of eligible Californians miss out on CalFresh. And as the senator noted, our state ranks last in the nation when it comes to enrolling eligible older adults over age 60. We want to acknowledge the hard work of CDSS leadership and of the counties to implement new policies intended to ease and expand access, especially for older adults. But in order to close that participation gap, we need to use every available option to simplify access for CalFresh. And that's the intent of SB 107. As the Senator noted, the current CalFresh application is a complex 18-page document that can be challenging to understand and complete for anyone. And for many older adults and people with physical or developmental disabilities, it can be a major barrier to participation. Online applications work well for some applicants, but many older adults lack reliable internet access or don't feel comfortable sharing personal information online. And that's something we've heard consistently from stakeholders like our bill co-sponsor AARP, that older adults want the option of completing a simpler paper application. And we can do that by removing the unnecessary questions that don't apply to many older adults and people with disabilities, like those about earned income. And not surprisingly, other states that have done this, that use an elderly simplified application, have seen increases in participation. Now, regarding the telephonic signature issue, prior to the COVID crisis, only 21 of 58 counties offered clients the option to use telephonic signature to complete an application. During the pandemic, counties that didn't previously offer telephonic signature have been using a workaround process that's been made available through temporary federal waivers. And those waivers are being approved by USDA on a month-by-month basis. They will expire at some point. SB 107 would ensure that after those pandemic waivers expire, telephonic signature is available to all clients, no matter where they live in the state. We need to act now to make these improvements permanent, to simplify CalFresh access and close the participation gap. Thank you, Chair and committee members, for your time, and I'm happy to answer any questions.
Thank you, Mr. Call. We can move on to our next witness in support.
Hi, good afternoon. Can you guys hear me?
Yes, we can.
Good afternoon. My name is Lourdes Gonzalez. I work as a CalFresh outreach specialist here in San Diego, a food bank serving in San Diego County. I would like to thank the chair and committee for the opportunity to share my perspective on the issues of CalFresh access. Feeding San Diego serves over 500,000 people every week through emergency food distribution in our food pantry programs. We serve families, children, seniors, and many military families. Despite our efforts, we cannot meet the needs of all food insecure people in our service area, especially as the need has increased so much during the COVID. CalFresh is a very important program and helps meet much more of the need that our food bank ever could. Because of this, we have a whole team at our food bank dedicated to helping people enroll in CalFresh. We do outreach, provide support throughout the application process, and follow-ups with clients who experience challenges with their cases. We have a strong partnership with the County Health and Human Service Agency, who are responsible for completing the enrollment process that we help clients to. Even with the extra help we provide, the CalFresh application process is very complicated. A lot of times people get confused by the long application. It is especially hard for seniors who sometimes have a hard time and don't understand why they have to answer so many questions. I recently helped an older couple aged 72 and 91. They have many health problems and get Social Security income. They came to Feeding San Diego for help in applying for CalFresh because the process was so confusing. I helped them apply, but it took time and a lot of back and forth with the county. But finally, we were able to get them enrolled. I would like, it would seem a lot easier and take less time if the paper applications have shorter and less confusing. And not everyone has the help as an application assister like me. During COVID, we have been doing application entirely over the phone. This has been very helpful, especially in areas where there is a really big access to the internet. It would make a big difference to clients to be able to continue to complete the application process over the phone, even after the COVID ends. It makes it easy to sign up and also easier to complete reports and certification. That's why we support SB 107. It would be two important changes to make it easier for struggling people to get CalFresh benefits to buy the food they need. Thank you, Chair and committee members, for your time and interest in these important issues. I would be happy to answer any questions that you guys have. Thank you.
Thank you, both. At this moment, I'd like to open it up for public comment in support. But before I do that, Senator Wiener, do you accept the amendments that the committee has offered?
Yes, my apologies. I accept the amendments.
No problem. Thank you.
Actually, I don't think there were amendments.
Okay. Okay. Yeah.
You called me off guard there, Madam Chair. So,
You passed.
Okay. We are moving forward with a public comment in support. Please limit your comment to name, affiliation, and position only, and we will move with beginning here in room 4203. Seeing none, we are going to move on to the telephone public line. Seeing none, no one in room 2040. Moderator, can you please prompt individuals waiting to testify in support of SB 107 and provide the total number of people waiting to testify in support of SB 107?
Yes. And ladies and gentlemen, if you wish to show support for SB 107, press 1, then 0 now. Again, to show support, press 1, then 0 now. And we have about 22 on the queue.
Okay, thank you, moderator. Please open up the lines and call the support witnesses individually. And once again, I just want to reiterate, please limit your comments to name, organization, and position on the bill.
All right, we'll start with line 33. Please go ahead.
Good afternoon, Madam Chair. Christopher Sanchez with Western Center on Law and Poverty and Support.
Next, we'll move to line 52. Please go ahead.
Kelly Beam with HealthNet and California Health and Wellness, serving almost 2 million Medi-Cal members in California in support of SB 107. Thank you.
Next, we'll move to line 35. Please go ahead.
Good afternoon, Madeline Cooper from Nielsen Merksmer on behalf of Marin County and Contra Costa County in support.
Next, we'll move to line 36. Please go ahead.
Chair and members, Kathy Mossberg with the California Association of Food Banks in strong support of SB 107.
Next, we'll move to line 38. Please go ahead.
Good afternoon, Chair and members. Priscilla Quiroz on behalf of the San Francisco Market Corporation, better known as the SF Market, in support. Thank you.
Next, we'll move to line 12. Please go ahead.
Kelly Brooks on behalf of the County Welfare Directors Association here in support.
Next, we'll move to line 34. Please go ahead.
Justin Rauza on behalf of Roots of Change, also in support.
Next, we'll move to line 17. Please go ahead.
Libby Sanchez on behalf of SEIU California in support.
Next, we'll move to line 56. Please go ahead.
Cesar Pamintuan on behalf of Alameda County Community Food Bank in strong support of SB 107.
Next, we'll move to line 55. Please go ahead.
Good afternoon, Craig Pulsifer from APLA Health in strong support.
Next, we'll move to line 28. Please go ahead.
Aaron Pack from the ACLU of California in support of SB 107. Thank you.
Next, we'll move to line 54. Please go ahead.
Bessie Shorty, Del Norte County Emergency Food Security Task Force in support.
Next, we'll move to line 16. Please go ahead.
Nosher Kathok, Volunteer Policy Advisor for AARP in strong support.
Next, we'll move to line 15. Please go ahead.
Dr. Diana Shiba, President of the Los Angeles County Medical Association, the largest county medical association in the state of California, speaking on behalf of the organization in support of SB 107. Thank you.
Next, we'll move to line 24. Please go ahead.
Good afternoon, Derek Polka on behalf of the Los Angeles Regional Food Bank in strong support of SB 107.
Next, we'll move to line 32. Please go ahead.
Good afternoon, Heidi McHugh, representing Food for People, the food bank for Humboldt County, in strong support of SB 107.
Next, we'll move to line 37. Please go ahead.
Good afternoon, Jamie Morgan on behalf of the American Heart Association in support.
Next, we'll move to line 53. Please go ahead.
Teresa Anderson on behalf of the ARC and United Cerebral Palsy California Collaboration in strong support.
Next, we'll move to line 58. Please go ahead.
Hi, Henry Rogers from the Los Angeles County Medical Association, and we're in support of SB 107.
Next, we'll move to line 43. Please go ahead.
Hi, Denise Bridges, Open Heart Kitchen in Livermore, California, in support.
Next, we'll move to line 31. Please go ahead.
Hi, Justin Garrett, California State Association of Counties, in support.
Next, we'll move to line 20. Please go ahead.
Sasha Rosenthal on behalf of the Long Beach Alliance for Food and Fitness in strong support.
And next, we'll move to line 40. Please go ahead.
Hi, Amanda Hickson with the Del Norte and Tribal Lands Community Food Council, as well as the Del Norte Senior Center, in support.
And once again, to show support for SB 107, press 1 then 0 now. Again, to show support for SB 107, press 1 then 0 now. And we have about 2 more in the queue. We'll go to line 49. Please go ahead.
Meg Davidson with the San Francisco Marin Food Bank in strong support.
And just one moment. We'll move to line 59. Please go ahead.
Dolores Duran Flores with the California School Employees Association, here in support.
And at this time, we have no one else in the queue.
Thank you, moderator. At this moment, we will move to public comment in opposition of SB 107. Do we have any opposition in 4203? Seeing none. 2040, seeing none. We will move on to witnesses in opposition to SB 107 via teleconference service. I just once again want to remind, if you can limit your name and limit testimony to name, affiliation, and your position on the bill. Moderator, please prompt the individuals waiting to testify in opposition to SB 107.
Sure. Ladies and gentlemen, if you wish to oppose SB 107, press 1 then 0 now. Again, to oppose SB 107, press 1 then 0 now. And we have no one in the queue.
Thank you, moderator. At this moment, I will bring questions and comments back to the committee members on this bill. Seeing none, okay. Senator Wiener, would you like to close?
Respectfully ask for an aye vote.
Thank you. Do we have a motion on SB 107?
So move.
We have a motion by Senator Cortese to do pass, but first be referred to the Senate Appropriations Committee. Secretary, can you please call the roll?
SB 107, the motion is due passed, but first be re-referred to the Committee on Appropriations. Hurtado?
Aye.
Hurtado, aye. Jones? Aye. Jones, aye. Cortese?
Aye.
Cortese, aye. Pan?
Thank you. We will, at this moment, place the bill on call.